Okay, so have you ever had one of those moments, where you just feel a bit off? Like maybe a sudden dizzy spell or some numbness that just, poof, vanishes.
Hmm.
We tend to just brush that stuff off, don't we? Think, it's nothing. But what if? What if those little moments are actually your body waving a red flag?
It happens all the time. And it really points to a major blind spot in how we think about health, especially as we get older. Lots of people are missing the signs of what we often call a mini stroke.
Right. So today, that's what we're really digging into. Those moments you might just ignore, those quick signals that could actually be, well, vital warnings.
Exactly.
We're talking about transient ischemic attacks, TIAs, or, yeah, mini strokes, and we're especially looking at how they impact older adults. Our mission here is pretty straightforward. Help you quickly understand what these are, why spotting them is just so critical, and importantly, what you can actually do. This stuff really matters for health, for peace of mind.
Absolutely. And the statistics really highlight why we need to talk about this. The American Stroke Association estimates about 240,000 people in the U.S. have a TIA each year.
Wow, 240,000.
Yeah, it's a big number. It shows how common they are and, why it's so easy to miss or misdiagnose if you don't recognize the symptoms.
And here's the part that really gets me. It's quite sobering, actually. Nearly 1 in 5 people, so almost 20%, who have what seems like a mini stroke. They go on to have a major stroke within just 90 days.
That's the critical warning. It's not just about looking back at a weird symptom that passed.
No, it's a window, right? A really crucial, time-sensitive chance to potentially stop something much worse from happening. It's about urgent action.
No, exactly. It's a warning shot. So, okay, many of you listening have probably heard mini stroke or TIA, but let's pin down what it actually is.
Yeah.
Because it's that temporary nature that makes it so tricky.
Right.
So essentially, a TIA is like a temporary traffic jam in your brain's blood supply.
Oh.
A blockage, but a brief one. The clot causing it usually dissolves or maybe gets dislodged on its own. So the symptoms, they typically last less than 5 minutes, sometimes a bit longer, but generally very brief.
So it's not the full-blown, potentially permanent damage of a major stroke, but more like you said, a warning flare. A sign that something else could be coming.
Precisely. It's a huge signal that there's an underlying issue, maybe with your blood vessels, that needs checking out fast. Think of it like the TIA is your body running a diagnostic test that failed. It revealed a weak spot.
Okay, that makes sense. So to really get it, maybe we should quickly touch on the main types of major strokes it's warning us about.
Good idea. So there are 2 main kinds. First, ischemic strokes. These are the most common, like almost 90% of cases.
Ischemic.
No.
That's where there's a blockage.
Right. An obstructed blood vessel stops blood from getting to part of the brain. The other main type is hemorrhagic. Much less common, maybe just over 10%.
And hemorrhagic means bleeding, right?
Exactly. A blood vessel actually ruptures, leaks blood into the brain, which then builds up and presses on brain tissue. Big difference from ischemic.
So the key difference then between those major strokes and a TIA is really about the impact and how long it lasts.
That's the crux of it. Major strokes, whether ischemic or hemorrhagic, can cause lasting disability. A TIA, because that blockage is temporary, usually only causes temporary effects.
Right, minutes versus potentially hours, or even permanent effects.
Yes, the symptoms of a TIA typically last just minutes, maybe up to an hour in some cases, but usually very short. Major stroke symptoms can stick around for up to 24 hours or, well, become permanent.
And the really tricky part you mentioned earlier, you often don't know which it is while it's happening. Only afterwards, if the symptoms resolve, you might realize, okay, that was probably a TIA.
Exactly. Hindsight is 20/20, but you can't wait for hindsight. And it's worth mentioning there's another type too, silent strokes.
Silent strokes. Okay, that sounds unnerving. How can a stroke be silent?
Well, they're called that because they often don't have those obvious dramatic symptoms. No sudden loss of function you'd notice immediately.
So you might not even know it happened.
Very often, yes. Especially common in the elderly. Sometimes other parts of the brain just compensate, so the person isn't aware, which loops back to why even subtle, fleeting signs are so important. Your body might be whispering, not shouting.
Okay, so let's talk about those whispers, those signals. We've established they can be fleeting, they're warnings. You mentioned dizziness earlier as a common one.
Yes, sign number 1, dizziness or balance issues. It's very common, often one of the first things people notice.
Well, and dizziness specifically.
It often relates to blood flow being reduced to the back part of the brain, the cerebellum, which controls balance. So if you suddenly feel unexplained dizziness, like the room is spinning, or you just can't keep your balance, That's a call your doctor immediately situation.
Got it. Okay, so beyond feeling unsteady, what's another key sign? Maybe something more physical that you can see or feel.
All right, sign number 2 is probably the one most people associate with stroke. Numbness or drooping.
Ah, yes, like on the face.
Exactly. Sudden, unexplained numbness or maybe weakness or that visible drooping often on one side of the face or in an arm or leg. It's a very distinct sign.
And that happens because the lack of blood flow affects nerves and muscles.
Precisely. That shortage of blood and oxygen messes with sensory processing, muscle control, nerves, skin sensation. And crucially, strokes usually happen on one side of the brain, so the symptoms tend to show up on the opposite side of the body.
So we're talking specific things like maybe someone tries to smile and one side doesn't move properly, an uneven grin.
Yes, or difficulty moving the face normally when talking or eating, maybe even drooling unexpectedly.
Or like one arm feels heavy, weak, can't lift it.
Difficulty lifting or moving a limb, maybe trouble walking steadily, losing coordination. All those point towards this sign.
Those examples really help. Okay, what's sign number 3?
Sign number 3 involves difficulty speaking or seeing. Again, it's about that compromised blood flow affecting brain areas responsible for very specific functions.
So, speech, how does that manifest?
It can show up in a few ways. One is dysarthria. That's basically slurred speech. It might sound slow, indistinct, maybe mumbled or hard to understand. The muscles for speech, like the tongue and lips, aren't working right.
Okay, slurred speech. What else?
Then there's aphasia. This is more about language processing. Someone might struggle to find the right words, or maybe what they say doesn't make sense, almost like jumbled words or even made-up words. They might also have trouble understanding you.
Wow, okay, so it's not just producing speech, but understanding it too.
Right. And a third one is apraxia, which is more of a physical challenge. The brain has trouble telling the tongue and lips how to move correctly to form words, even if the muscles themselves aren't weak.
So basically, any sudden change in how someone speaks or seems to understand language is a major red flag.
Absolutely. And don't forget vision. Difficulty recognizing objects or faces, or even judging distances. Visual spatial awareness can also happen if the stroke affects the visual processing parts of the brain.
Got it. Speech and vision changes. You mentioned earlier how brain function overall is impacted by oxygen supply. Does that lead to other signs?
It does. Which brings us to sign number 4. Inability to concentrate. When the brain isn't getting the oxygen and nutrients it needs, just basic cognitive functions like focusing become really difficult. It's a noticeable drop in mental clarity.
And that lack of clarity can sometimes become more severe, leading to sign 5?
Yes, sign number 5. Confusion. This can be really alarming to witness.
Yeah, I can imagine. What does that look like?
Well, the person might seem suddenly disoriented, maybe frustrated because they can't think straight. They might not know who they are, where they are, or even what day it is.
That sounds serious.
It is. And the urgency here is key. Getting treatment fast can often reverse this confusion. But if it's ignored, it could potentially lead to longer-term cognitive problems like memory loss or even contribute to dementia down the line.
And it comes on suddenly.
Very suddenly. It often interrupts whatever they were doing. They just can't think clearly, can't process information, can't speak coherently.
Okay, sudden confusion. Big warning sign. What's number 6?
Sign number 6, severe headache. Now, lots of things cause headaches, obviously.
Right. How do you tell if it might be stroke-related?
The key is usually the onset and severity. A stroke-related headache often comes on very suddenly, and it's typically severe, sometimes described as the worst headache of my life.
Okay, different from a migraine then.
Generally, yes. Migraines often build up, maybe have that throbbing quality, sometimes visual disturbances or tingling beforehand auras. A stroke headache is more like a thunderclap, sudden, intense pain.
So if someone gets a really unusual severe headache out of the blue, especially if it lasts?
Yes, if it's very unusual for them and lasts more than, say, 4 hours, getting medical advice is definitely wise.
Okay. What about number 7? You mentioned fainting earlier.
Right. Sign number 7 is syncope, or fainting.
Syncope. That's a medical term.
Yes. It means a sudden, temporary loss of consciousness and muscle control. Usually lasts less than 5 minutes.
And that's caused by the brief blood flow disruption.
Exactly. The brain just momentarily doesn't get enough blood. Now, people faint for various reasons, but if it's a serious episode, especially if they seem confused or weak afterwards, that needs checking out medically right away.
Makes sense. And the last one, number 8, was hallucinations. That seems less expected.
It is less common, yes, sign 8, hallucinations. But some people do experience them during or after an ischemic event like a TIA.
Is there a known reason why?
It's complex, but one link is that these kinds of attacks, these ischemic events, can increase the risk of developing vascular dementia later on, and hallucinations can sometimes be a symptom of that. But again, the overarching thing with all these TIA symptoms, they typically last only a few minutes. It's their appearance, however brief, that's the critical warning signal.
It really hammers home that point, doesn't it? That fleeting doesn't mean insignificant. What's one thing people often get wrong about TIAs? A big misconception.
Oh, definitely. The idea that if the symptoms go away, you're in the clear, that everything's fine now.
But that's not right.
Not at all. It couldn't be further from the truth. The TIA, the temporary event, might be over. But the reason it happened, the underlying blockage risk, the vascular problem, is almost certainly still there.
Like ignoring a flashing engine light just because it turned off for a bit.
Perfect analogy. The TIA was the warning light. The engine problem still needs fixing. It's a wake-up call, not just, a brief glitch.
Okay, that's crystal clear. It's a call to action. So, thinking about action, beyond recognizing the signs, what about the lifestyle side? What factors increase the risk, especially for older folks, and what can we actually do proactively?
Good question. Several lifestyle factors definitely play a role. Poor nutrition is a big one. What you eat directly impacts your vascular health and blood pressure, raising the risk if it's unbalanced.
So, focusing on a balanced diet, keeping blood pressure in check, that's key.
Absolutely essential. And then there's being sedentary.
Yeah, I figured that would be on the list.
Not moving enough is directly linked to TIA risk. Regular exercise is just so important for cardiovascular health, keeping blood flowing well.
Okay, diet, exercise, what else?
Stress, or rather, the inability to manage stress effectively. Chronic high stress can really elevate blood pressure, and that directly increases stroke risk.
So diet, exercise, stress management, these are things we can actually influence.
Exactly. These are areas where we generally have a good degree of control, which is empowering.
Okay, so we know the signs, we know some risk factors, but when those signs do pop up, acting fast is everything. I know there's a really simple, effective tool for that. Can you walk us through the FAST acronym?
Yes. FAST is incredibly important. Easy to remember in a stressful moment, and it's pushed by the National Stroke Association for exactly this reason. It helps you identify signs and know what to do.
Okay, so F.
F is for face. Ask the person to smile. Look closely. Is one side of the face drooping or looking uneven?
Got it. Face drooping. A is?
A is for arms. Ask them to raise both arms straight out. Watch carefully. Does one arm start to drift downwards, or do they struggle to lift one arm at all?
Okay. Arm weakness or drift. S.
S is for speech. Ask the person to repeat a simple sentence like, "The sky is blue today." Listen to how they sound. Is their speech slurred? Does it sound strange? Are they having trouble speaking or understanding the request?
Slurred or strange speech. Okay, F, A, S, and T.
T is for time.
Yeah.
And this is the action step, the most critical part. If you see any of these signs, face drooping, arm weakness, speech difficulty, timings, call 911 or your local emergency number immediately.
Immediately, even if the symptoms seem to be getting better.
Absolutely. Don't wait to see if they disappear. Get the person to an emergency department right away for evaluation for possible stroke or TIA. Time is brain. Every single second counts.
F-FASTY. Face, arms, speech, time. Call 911. Okay. So they get to the hospital. How do doctors figure out if it was a mini stroke, especially if the symptoms are already gone?
Yeah, that's the challenge, which is why going to the hospital is vital regardless. Doctors need to find the cause. They'll often use imaging tests, things like a CT scan, computed tomography, or an MRI, magnetic resonance imaging.
Looking at the brain.
Yes, looking at the brain itself and often the carotid arteries in the neck, too, which are common sources of clots. They're trying to see if there was any damage, even minor, and identify what might have caused that temporary blockage.
Okay. And thinking about risk factors again, specifically for older adults, what are the main ones, and is there good news there?
Well, the main culprits are pretty well known. High blood pressure or hypertension, high cholesterol, obesity, smoking is a big one, diabetes, and as we mentioned, an inactive lifestyle.
And risk generally goes up with age.
Right, it does, unfortunately. The risk for stroke and TIA does increase as we get older, but here's the empowering part. Most of those risk factors, they're manageable.
So we can do something about them.
Yes, that's the positive message. High blood pressure can be treated. Cholesterol can be managed. You can stop smoking. You can manage diabetes. You can become more active. There are real opportunities for prevention, even later in life. It's about taking control where you can.
That really is empowering. What specific prevention steps does the CDC highlight?
The CDC recommendations line up well with managing those risk factors. So number one, controlling and treating high blood pressure, super important.
Right.
Managing cholesterol levels. Avoiding smoking altogether or quitting if you do smoke. And sometimes regular use of aspirin, and this is crucial, only under medical guidance.
Okay, that aspirin point seems really important. Why the caution?
Because aspirin thins the blood, which can help prevent clots in some people, but it should absolutely not be taken to treat an active stroke or TIA. Because if the stroke happens to be the bleeding type, the hemorrhagic kind, aspirin could make the bleeding much worse. So the rule is, if you suspect a stroke or TIA, don't take aspirin, call 911, let the medical professionals figure out the type and the right treatment.
Got it. No self-treating with aspirin during an event. Seek immediate medical help.
Correct.
And overall health. Does that play a role in how someone recovers if they do have an event?
Definitely. A person's general health condition often makes a big difference in recovery. If you're generally healthier going into it, your chances of a better recovery are usually higher.
And for treatment, say for an ischemic TIA or stroke?
If it's confirmed to be ischemic caused by a clot, then treatments often involve medications to dissolve that clot, or sometimes procedures to actually remove the blockage and restore blood flow. Again, underlines why getting to the hospital quickly is so vital.
So it really all circles back to looking after your overall wellness, doesn't it? Even though risks increase with age, taking care of yourself, doing things like balance exercises if you're older, managing health conditions, it helps maintain well-being and gives you peace of mind.
Exactly. It's about being proactive, listening to your body, and being ready to trust that warning shot if it happens.
It's about knowing what to look for and being prepared to act.
Indeed. It's about empowering yourself, empowering your loved ones with this knowledge, and having the readiness to take swift action.
So today we've really unpacked the world of mini strokes, TIAs. We've looked at what they are, those critical signs to watch for, and the absolutely vital steps to take immediately. Remembering fast, recognizing those signs. It can genuinely save lives, prevent much worse outcomes.
Yeah, just gaining this knowledge, understanding this, it's a really powerful step. It helps protect your own health and the health of the people you care about. You shift from just, hoping for the best to being an informed advocate for well-being.
Absolutely. So, as you think about everything we've discussed, here's something to mull over. Given how subtle and quick these mini strokes can be, these TIAs, what deeper awareness can we maybe cultivate about our body's signals, even the really faint ones? And how can knowing this stuff truly empower us to insist on getting medical help fast, even when symptoms seem to vanish just as quickly as they appeared?